This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Can everybody see that okay?
Yes, we can.
I can, David.
I'm David. I'm one of the chief residents at MetroHealth. Charnay Mead is also on the call. I just wanted to spend some time, introduce our program, tell you guys a little bit about what we do and the different opportunities that you'd have if you came here for residency in Cleveland. Just a little about myself. I went to med school in New Jersey and then came out here to the Midwest for residency. I am in the midst of applying for a spinal cord injury fellowship. Charnay, do you want to introduce yourself?
Yeah. So I apologize if I don't come off clearly. My internet may be a little spotty, but I'm Charnay Mead. I'm also a PGY4. I'm the academic chief resident. I did my undergrad training at Michigan, and then I went to Michigan State for med school. And then I left Michigan to come to the Case Western, and I'm applying for a sports medicine fellowship.
So big picture things, our program has 6 residents per year. We are at this point all categorical, which is pretty exciting. This past year was our second full class of grads that just came on. So we have a total of 24 positions, and our categoricals spend their year at MetroHealth main campus before coming to us at kind of the old Brooklyn campus of MetroHealth just down the road to complete the remaining 3 years of their PM&R residency. So one of the nice things that we have particularly involved in our intern year is that we get to have a full month on service with a senior resident on the stroke service. So you're on the floors, that's your only responsibility. You don't have any call when you're over here with us. No medicine didactics, nothing. You're totally immersed in the PM&R world for that month. And you work directly, you're not shadowing, you're resident on the floors, you're expected to have the responsibilities of a resident. You get to train and see how we run the floors, as well as get to experience what it's like transitioning patients from the acute hospital to acute inpatient rehab, which is probably one of the best parts of intern year, in my opinion. Gives a nice break in between the floors and just regular intern life. This is one of the oldest PM&R residencies actually in the country. So we've been accredited since the 50s. And we have pretty significant connections throughout the city. And we rotate not only at our kind of mothership location at MetroHealth, but we also have outpatient rotations at the Cleveland Clinic, and we have close ties with the VA. So we do have connections with University Hospital, who has a relatively newer PM&R program. And in particular, we all do didactics together, and we host those kind of citywide every Thursday. So these are kind of the big wigs of the program. Dr. Placeway is our program director. Dr. Rainey is our APD. Dr. Che is our department chair, who some of you may be familiar with. He's more nationally recognized and previously held positions of president of AAP. And then, of course, our program coordinator, Randa Karam, kind of runs the show. She's like our mom. She takes care of us. She's constantly feeding us. one of our residents says she's never happy unless you're chewing. So we stay fat and happy, and she is probably one of the biggest draws for me for the program. Her and Dr. Placeway have really taken us all under their wings and given us an opportunity to grow and develop into excellent physicians and clinicians, as well as just excellent people. And they give us the opportunity to really extend our strengths and develop our weaknesses and really turn us out into really great physicians. So I'm very privileged and honored to be here. So a little bit more about our intern year. The split is about 21 to 22 weeks of inpatient medicine, split amongst kind of gen med floors, cards tele, step down, and we have about 6 weeks of nights and then 12 weeks of elective, which seems actually very generous from the other advanced standing positions and things that I've seen. And then of course that kind of 4 weeks of that MetroHealth inpatient with us. There is no clinic for any PM&R intern and for any advanced or for any prelim residents. So that includes the other essentially 6 prelims who are typically case graduates at the kind of in combination with the MetroHealth internal medicine program. The 4 weeks of vacation is 2 2-week blocks. And those are kind of designated right before the start of rotations. Like the schedule was set in June, right before the new interns started this year. In regards to our PM&R,
I do want to highlight too.
Oh yeah.
Sorry, lagging a bit. So I want to highlight from our intern year too. We're not ever on call. We have a night float system, and the night float system is pretty nice because you're not. When you're on night flow, it's 2 weeks at a time and you work every other night. So it was actually, other than of course our electives in the PM&R months, it was probably my favorite rotation.
Yeah, so this gives a little breakdown of our different rotations for each individual year. We are kind of a tapered inpatient heavy in the front and then more outpatient as you become more of a senior. That also kind of goes along with our call schedule, which we will talk about a little bit later. But this is actually a relatively recent change. I would say right before my class, it was 9 months, if not more, of Metro inpatient for like almost a total of 10 or 11 months of inpatient, including our VA counterpart rotations. So we now have half a year of Metro inpatient, and those are dedicated stroke, TBI, and spinal cord injury floors. We have one of the only locked units, I believe, in Ohio, and the only locked TBI unit in Cleveland. So we get to see the highest acuity TBI patients. And our spinal cord injury unit is a model system. And so we also get patients from all over, not only Northeast Ohio, but we've had people from Pittsburgh, from the South, and even Indiana and Michigan as well. Our outpatient rotations are kind of broken down into subcategories of musculoskeletal, sports medicine, interventional pain, and more of a neuro rehab type clinic. And then kind of scattered throughout those outpatient rotations are procedural clinics as well, particularly with interventional pain, but also with our MSK, we have two dedicated half days, and then Friday is a full day of ultrasound guided injections with our attendings. We have Dr. Clark, who is pretty nationally recognized within amputee medicine, and we have 2 physicians who do cancer rehab as well. We do a consult rotation, which is half time spent seeing inpatient consults, and then the other half we get daily sessions with our department chair, Dr. Che, where we have the opportunity to talk about different aspects of medicine and PM&R that we may not have otherwise. So he goes through a research module in the of our PGY2 year. And the second, he talks about business of medicine, as well as leadership skills. Our VA inpatient months are split between one general and one dedicated SCI. We get to kind of continue our, and you get to see a different style of inpatient medicine compared to, I would say, a little bit more intense metro inpatient from a kind of stroke standpoint on the general floors, and then more dedicated SCI. And you get to see chronic SCI, which you don't often see at metro inpatient because we see all of the acute traumatic injuries. Into our PGY 3 and 4 years, we have a much more outpatient heavy, as I mentioned, and we also get to start rotating at Cleveland Clinic to do sports. We do inpatient consults with them, and then Cleveland Clinic also does the pediatrics rotations. We have two elective opportunities during PGY 3 year and one during PGY 4, and it's really make of it what you will. We've had multiple residents as of late do outside rotations. Shernay is one of them, and I'm sure she can speak to that. And we've had another who was in California for the past year, or not for the past year, for the past month at Loma Linda, be pursuing a lifestyle medicine fellowship afterwards. So she was able to connect with them. But Shernay, do you want to talk about electives?
Yeah, so the elective process, if you're considering going off-site, it's something that, like we said earlier, Dr. Placeway and Randa are very, very supportive. So if you find something unique that pertains to PM&R that you really want to pursue that our program doesn't have, they're very supportive of you setting up that rotation. So if that's something that's interested to you, then something that our program will definitely work with you to make happen. It is a bit of a process, but now that there's a couple of us that have gone through it, we'd be more than happy to talk you through the process and get you off the ground.
This kind of gives a little bit more specifics about each of the individual rotations. Like I mentioned with our interventional pain, I would say at this point, it's at least 60% or more of dedicated procedural days. So you're either one-on-one or with one fellow doing running multiple rooms with the attending and doing all fluoroscopic guided procedures, which is really awesome. So they get us, and kind of throw us into the pool, and we get to have a lot of training with them. And I feel like many of our classmates have gone on to pain fellowships. Our past year of graduates, there's how many? 3, right? RJ.
2 did pain.
Oh yeah, and
one's doing TBI, and then the other 3 are doing sports.
Mm-hmm. But I think from our exposure, we would feel, very confident going into the interventional pain fellowships in terms of our procedure numbers, even graduating as residents. The musculoskeletal outpatient blocks have a sports clinic, and then the ultrasound and guided injections. From a neuro rehab standpoint, we kind of see all of the big 3, in addition to doing Botox injections as well as ITB pump management. And so those are good skills to kind of have in our back pockets. From the general rehab outpatient, we have the lymphedema, cancer, and amputee. And then our specialty month is entirely EMGs, Botox, and ultrasound guided injections. So that's a nice procedural heavy month. These are just some pictures from our inpatient rehab units. So the top left is on our top of 8th floor. It's our TBI locked unit, and so the therapy gym is attached to that floor. And you can see that we have really nice, views throughout our inpatient rehab. If you squint a little bit, you can see the brand new hospital that's being built. That's set to open in 6 months, 3 months. The countdown is rapidly approaching. So when you guys are going to be starting, you'll be in the brand new hospital, which is really exciting. And so in addition, we've also received multiple multiple millions of dollars to renovate the old Brooklyn campus, which is the standalone acute inpatient rehab. And so that has gone into not only areas for the residents, but also for staff and faculty. And we did a major overhaul to our inpatient stroke unit to give more individual beds. And so the top right picture is our workroom, I believe, on the spinal cord injury unit. Same thing with the bottom right. That's our workroom where it's just the residents, med students, and attendings, and we get to hang out there during the day. And then the bottom kind of middle is our kind of open area with the nursing fishbowl and then the patient rooms. Unfortunately, because of COVID, we've had less kind of congregation of patients, but previously they used to eat meals out there together and be able to get to know one another and kind of commiserate about kind of the different injuries that they've had.
5-minute warning.
So the other picture, this top right one is one of the newer stroke unit individual rooms, and then some pictures of us rounding on the floors. This is our renovated outpatient clinic, and the top left is one of our EMG suites. So we have two rooms and actively kind of run between them, seeing patients. And the bottom left is kind of the dedicated doc workroom, probably 12 workstations where the attendings and residents all get to sit together. This is our resident lounge on the top left, and the top right is our brand new didactics area. So we host all three of the programs for didactics every Thursday, and we've been gifted this space, which has been really awesome. Brand new, huge screens, and totally connected with all of the kind of latest features so that we can not only share lectures, but we've also casted ultrasound procedures through it. But it's been a really nice addition. Like I mentioned, we have dedicated units for each of the big three: stroke, spinal cord injury, and brain injury. And being the model system with spinal cord injury, we have kind of dedicated resources to allow us to continue our research, but and also provide excellent care as a model system. Quickly over call, it's a tapered call schedule. It gets significantly better by PGY 4 year. You have no call, which is awesome. I would say that our calls are 4 p.m. Until 7 a.m. It's a kind of like a 24. And then you have a post-call day, and you're never expected to, have work duties after you're off call. Sharna, use didactics.
Yeah, so our didactic curriculum was actually recently overhauled. We have two new sports medicine trained attendings, and when we hired them in January, we started this new didactics curriculum. So it'll follow our 18-month didactic cycle. Actually, it'll be every year. So we'll hit all of the peripheral joints in a matter of a year. So we'll get lectures, and then we get hands-on time with the ultrasound twice a month.
2 minutes left.
So these are kind of just the benefits. I would say pretty typical amongst programs, but 20 business days for vacation, which equates to 4 weeks. We have a nice process where we can give weekends tagged on, so it ends up being a lot more vacation than just the individual 20 days. We have conference days and interview days, and we have dedicated funds set aside for any resident who's going to be presenting at major conferences. I was a recipient of that recently at AAP, and they covered everything, and that was not taken out of our dedicated fund for books and other resources, just because we were able to present. Continuity clinic is something that you do as a senior resident, as a 3 and 4, and you'll get 1 year of neuro outpatient clinic and then 1 year of MSK. I think that it's been a really great opportunity to see patients after they've been discharged from acute patient rehab and kind of follow their course, after the sequelae of their initial injury. In terms of fellowships, we have 2 positions in spinal cord injury, being the model system. We have 1 for TBI, and then we recently went from 2 positions of pain to 4 positions for our interventional pain program. Dr. Kim has been spearheading that department and has done an incredible job at bringing in not only resources for us, but education, and has really taken it upon himself to make sure that we are prepared if we are interested in going into interventional pain, but also bringing out incredible fellows.
Unfortunately, we're out of time. So if you want to have like another 30 seconds, any last things you want to say, and you can stay and kind of monitor the chat for a little bit as the next program starts.
Yeah. Last big thing, we are ranked number 2 in NIH funding amongst PM&R programs. Dr. Che has really taken it upon himself to get research funding for us, and we have had, I would say, endless amounts of research opportunities. It's just a matter of what you are interested in. There is a PhD who's working behind the scenes who you can pair up with. I personally am doing urodynamic studies, and then I'm also working with our cancer rehab attendings, doing a multi-center retrospective.
Awesome. Thank you so much, Case Western, MetroHealth.